Now, WHO has often asked for randomized controlled trials, the key kind of clinical evidence that shows a mode of transmission. Well, we finally published this summer this paper. Jonathan Van Tam is the lead author. He was the lead PI. I was a co-PI on this project back in 2012-13, where a keystone piece of this was this quarantine study, where we recruited 126 people, inoculated about a third of them with virus, and then had them spend the next 4 days in a room playing Monopoly and table hockey and sharing the same keyboards, and trying to see if they would transmit the infection. And we had intervention recipients like this person here wearing a face shield and hand sanitizing with alcohol, hand rub every 15 minutes. And we had control recipients who had no intervention, and we had the donors who had been inoculated, and we had minders in here wearing a respirator, trying to make sure that people had plenty of close contact. We monitored temperature and carbon dioxide. We collected exhaled breath on more than 1 day from each of the donors in the Gesundheit 2. We collected daily nasopharyngeal swabs, measured their temperature and recorded their symptoms 3 times a day, housed them separately, moved them between rooms to make sure that any differences between rooms were adjusted in the model. Was nearly impossible to transmit infection. We had 1 recipient out of 75 who developed a rise in antibody titer. Nobody had confirmed fever by infection by PCR. Nobody and the recipients had fever or got sick. The person who transmitted, who had the rise in antibody titer had no symptoms and no PCR positivity. So these donors were all shedding a lot of virus in their nasopharyngeal swabs, and they had plenty of chance to have direct contact transmission. So if large droplet sprays and fomites were important, you would think we would have transmitted a lot of infection here, but we didn't. But as you've heard, some of you in a talk by Jake Bueno de Mesquita, then the aerosol exposures here were very low. The donors, most of them were not shedding virus that we could detect in the air. And we were unable to detect virus in the air using N95 samplers, even though that has been shown that you can detect influenza virus in the air in dining halls on college campuses, as well as in medical clinics during flu season. So the fact that we couldn't pick it up in the air suggests that there was very little aerosol exposure and implicates aerosols as the primary mode of transmission in this model between